If the word of one of the most senior public health officials in this country means anything, the infiltration of COVID-19 here has reached a new stage of desperation. New South Wales Chief Health Officer Kerry Chant today elevated the outbreak in southwestern Sydney to a national emergency.
And can I just say, my heart goes out to the people in southwestern Sydney and Western Sydney for the impact this virus is having on them.
On the basis of deaths, it is not a national emergency. It is clearly not. So for the record, New South Wales had one additional death overnight, an 89-year-old man. It had another 136 infections, 53 out in the community and 59 under investigation from a whopping 86,620 tests. No signs of green shoots, granted, but the Premier has extended the hotspot stay-at-home zone to two further local government areas, and that's Cumberland and Blacktown. Both have seen virus numbers spike in the past 3 days. So it's slowly shifting out of Fairfield to other areas. But is there a sense of panic in Macquarie Street? These numbers, they are not escalating as we saw last year by 50 a day. And we're not yet seeing the result of this week's harder lockdown because those numbers will emerge Sunday, Monday, Tuesday. But New South Wales has now asked the federal government to redirect Pfizer vaccines to younger people in those zones who need to work in essential services.
We need to have a discussion about refocusing the national vaccination strategy. Now, what we've done as a government is refocus our efforts in distributing vaccines in southwest Sydney. We have a micro plan for how we will get not only more doses of AstraZeneca in arms, but we also have to acknowledge that that is a very young population in those communities, and we need at least more first doses of Pfizer.
Some might argue that New South Wales was there for every other state and territory when overseas arrivals needed to be picked up and housed in hotel quarantine. They were there week in, week out, and now they need additional help. We'll get to what the Prime Minister said late this afternoon shortly. But if access to more Pfizer vaccines is what New South Wales needs to control this Delta outbreak, it's not what Federal Health Secretary Brendan Murphy thinks is the be-all and end-all. In a Senate inquiry today, and an answer to the advice he gave government over what vaccines they should strike deals for, he was very defensive and not convinced of the New South Wales Premier's reasoning.
Every state and territory leader I have heard has said that the low vaccination rate is linked to the lockdowns and that lockdowns will continue while we have low levels of vaccination, and you're saying that's not correct.
It's a complex picture. Certainly vaccination, high vaccination is a factor in transmission, but I don't think you can directly attribute the lockdowns to our vaccination rate. If we had been where we planned to be, which is 2 months, we're about 2 months behind our original plan because of the issues with AstraZeneca and international supply, it may well be that many of those states would have locked down anyway.
Can I just say, the Prime Minister seems to be taking all the heat at the moment for all the decisions made about vaccine selection and the collapse of Pfizer's supply. But it was Professor Murphy, when CMO at the beginning of the pandemic, who gave the government all the key advice on those decisions. He deserved the grilling he copped today in that Senate inquiry, and so does his entire team. Meanwhile, the Victorian Premier accepted that we were at a turning point in the pandemic, but he wasn't keen on sharing his state's allocation of Pfizer for the Western Sydney crisis. No surprises there. But his view was to protect his and other jurisdictions, the New South Wales government needed to do what he did last year.
Sydney is on fire with this virus, and we need a ring of steel put around Sydney.
So if Sydney is on fire and they need a ring of steel, don't you put all the resources you can into the fire front? I'll get back to that in a second. I still think a strategy aimed at specific local areas while lifting restrictions in areas outside of the infection hotspots has served New South Wales well. But Delta has sent New South Wales into a spin. While in Queensland, the variant is already leaking from New South Wales, with a flight attendant crewing 6 trips to regional Queensland whilst infected since July 11.
What this shows us is that we're living in a new norm now with the Delta variant.
And the state seems to have run out of patience with those misbehaving NRL players and their families. One more breach and they're out.
I'm very, very concerned about what is happening with these NRL players, and you would have seen that imagery of the family hotel where they were sharing goods between verandas, so I am very concerned.
And news just through only 1 minute ago is that Api Coruscant from the Penrith Panthers has copped a 2-week ban from playing because of the fact that he allowed a woman into Origin camp during the second state of Origin. Will they learn? There's still 10 weeks to go of that competition, and only a supreme optimist would predict that no other player or a member of their family breaches the rule again in that time, which means maybe the NRL needs to begin talks with the Northern Territory, because that might be the last place that they can set up camp. Back to the vaccines. So much of this national emergency could be allayed if only those over 40 in this country, especially in Western Sydney, would get at least one AstraZeneca jab. Now, there's endless supply of this locally produced dose, and yet, as Kerry Chant said today, the mythology had exceeded the facts.
The Chief Health Officer would not recommend AstraZeneca to someone that they care about if they had concerns that the risks of AstraZeneca are infinitesimally small compared to the benefits. So can I just be very, very clear that we need to correct the mythology about AstraZeneca. And in the context of the Delta threat, I just can't understand why people would not be taking the opportunity to go out and get AstraZeneca in droves.
You can see the frustration on her face. You've got all of these AstraZeneca vials sitting in boxes, refrigerated in everywhere, pharmacies soon, doctor surgeries, federal clinics, state clinics, and there's not enough people coming in to get them. And the New South Wales Health Minister, Brad Hazzard, was cranking up the rhetoric as well, declaring that those unvaccinated in New South Wales had a duty to get the jab, and he mounted a very strong argument.
If you're over 60 and you get the virus, you have a 1 in 200 chance of dying. If you're over 50, you have a 1 in 500 chance of dying if you get the virus. As opposed to that, if you have the vaccine, the AstraZeneca vaccine, it protects you to the extent that your chances of actually dying are 1 in 2 million.
So it's 1 in 200 in New South Wales in terms of dying. We've got a situation where it's 1 in 2 million across Australia, 1 in 200 in terms of any kind of side effects. But look, the New South Wales grapples with Delta. It's a big, big job, and the state and the city is on fire. But the jabs are there. If you're in Indiana, for instance, the rate of death from COVID, as opposed to the 1 in 200 in New South Wales, the rate is 1 in 58. 1 in 58 in many states around the US. Anyway, New Zealand has ended its travel bubble with Australia, and that goes on for at least 8 weeks. So how did the Prime Minister react to the New South Wales pitch for a redirection of jabs to Western Sydney? Well, late this afternoon, after National Cabinet met, Scott Morrison made it clear that the programs and allocations designated to other states and territories would not be compromised.
We are not going to disrupt the vaccination program around the rest of the country. That vaccination program is going and is hitting as it marks, and we want that to continue. The Delta strain of the virus is obviously very fast transmitting, and we need all the other states and territories to be continuing to get up to the mark, the marks that we need to set for ourselves to ensure we can get this job done this year.
That is code for no, you won't be taking currently allocated doses from elsewhere. Not surprising, really, the Prime Minister has never been keen in this pandemic to upset the state or territory leaders. He did point out that New South Wales will use existing approvals to use Pfizer primarily for first jabs in order to get as many people partially vaccinated. So for second timers for Pfizer, you'll be waiting the full 6 weeks for your second jab. But the question still remains. Sydney is on fire. As Dan Andrews says, why would you not throw all the resources you have at the fire front? All the fires are available, and New South Wales has done all the hard lifting. They're after help. It would create hell within National Cabinet, you can bet on that. And today, the PM opted to resist the fires of hell.